Okay, so we have applied topical numbing to our patient here. We're going to go ahead and leave the numbing on her décolleté because we're going to save that for last. I've already measured to see where I want my smooth thread on a blunt cannula to enter. I went ahead and I numbed with a little Lido and Epi, and you can use bicarb to take some of that sting away. I have a 21 gauge needle now that I'm going to use to make my port. What I'm using underneath the eyes are a 29 gauge 38 millimeter thread. It's a smooth thread. It's 29 gauge, 38 millimeters. So I don't know if you can see that, but it's very, very thin and it's short. So we're going to go ahead and insert that into her tear trough. You can also use threads that are on a cannula that are twisted, which gives a little bit more volume. Here we go. We're just going to be right underneath that skin. Super easy to insert. I like to put at least 5 to 10 in the tear trough. These will absorb over time. Her body will break it down. And while it's doing that, it's creating fibrosis and new collagen and elastin, helping to firm up that skin. So this is great anywhere where you're going to have crepey skin, where we have a little bit of volume loss. We're not really replacing volume. What we're doing is we're really helping to thicken and tighten up that skin. It should be right underneath the skin, just so subdermal, just right underneath the dermis. You can also be a little bit in the dermis, just not intradermal. Okay, that's 2 threads already. So the point of having this on a blunt tip cannula, you have one entry point, so you're not having to poke multiple needles into her skin and increase the risk of bruising. So with one entry point, with the blunt tip cannula for the under eye threads, I'm able to put many threads in and help build up that area and tighten up that collagen. These will absorb in about 3 months or so, but the lasting effect can last even longer. All these threads, the lasting effect, depending on their body, depending on the types of threads you're using, you can have the results last for up to 2 years. But your body does start to break them down, and we start to see the peak collagen production at about 6 weeks to 3 months. And this is something that's not one and done. You want to continue to do these treatments to help build up that collagen. So I have created my port with my 21 gauge needle. I've numbed it with 1% Lido and Epi. I'm going to go ahead and take my 29 gauge 38 millimeter smooth thread. It's on a blunt tip cannula, so I'm able to go ahead and insert as many threads as I want through one little port. And we're just going to be subdermal, just right below the dermis, just to help with that neocollagenesis. We're creating more collagen, we're creating more elastin. We're helping to thicken up and tighten up that skin. Okay, just pull the skin taut. Very, very easy to insert. Your patient's comfortable. I'm pressing down, I'm turning 360 degrees just to help get the thread off of the cannula. So you can see how quick this procedure is and basically painless for the most part. All right, just right underneath the skin right there, right into the tear trough. Go ahead and make sure the fontanelle is already pushed forward, press down, turn to help it engage and get it off the cannula. And there you go. Your body's going to absorb this over time. It's going to get better and better. It's not one and done. It's something that you want to continue to do based on how the patient's needs. You can also use smooth threads that are twisted that provide a little bit more volume in the under eye area. We can also make an entry point out here on the lateral canthus and go ahead and make a port, and we can stream these threads in this direction as well. With 1 or 2 entry points, we can fill in the entire area where she has some volume loss in the tear trough area. It'll stimulate collagen over time, and this is something that she can continue to do to help build up that area. We also have the twisted threads that will also create more volume in this area.